students. So next topic for endocrine system disorders is hypopituitarism. So hypopituitarism is a rare disorder again of the pituitary gland. Previously we have studied hyperpituitarism when it overproduce the hormones. But in this case it produces the hormones but under the normal level. Okay, so hypopituitarism is a deficiency of one or more than one pituitary hormones. So their deficiencies can affect the normal body's function, which include growth, blood pressure, or reproduction. Okay, there are typically different symptoms for each problem, but the main thing is the hormones are missing. So what would happen if it becomes underactive? So hypopituitarism is always being caused when there are the formation of benign tumors on the pituitary gland. Okay, and this underactivity of pituitary can affect various conditions, and it may be naturally or it may be caused due to the pressure on the tumor mass or due to some surgery or previous radiotherapy. Okay, so hypopituitarism can be caused by some meningitis infections around the brain, in the brain, or whenever there is any head injury, or like the conditions called sarcoidosis, which is the tuberculosis like infection. So the first condition in it is dwarfism. Like in hyperpituitarism there was acromegaly or gigantism. Here it is dwarfism. There the person is having excess of growth hormone, so their height is going to be more, like 6 to 7 feet. But in this case, in this condition, growth hormones is not produced properly. They are produced but under the normal requirements. So the person he will become dwarf. Okay, so it is a common condition in which the children are getting affected most commonly. Okay, and the most common effect is on their body growth. They will have short stature. Okay, so it can be congenital or it can be acquired by the other conditions. Next is Froehlich's syndrome, or normally known as adipose-genital dystrophy. Okay, it is again a rare metabolic disorder, but specifically it is in small childhood problems. Okay, and the problem is basically obesity or the growth retardation. Okay, and the third one is retardation of growth of genital organs. Okay, again it is being associated with the tumors of hypothalamus. Okay, which causes the increased appetite in the children's, which leads to the obesity. Okay, so next is hyperthyroidism. So hypothyroidism is the overactive thyroid problem. Okay, so in which the thyroid gland is producing hormone but more than the required concentration. Okay, this may accelerate body's metabolism, which may be seen in weight loss or some irregular heartbeat. Whereas the other condition is Graves' disease. It is an immune system disorder, okay, which results due to the hyperthyroidism. Okay, there are so many different disorders may result in hypothyroidism, but Graves' disease is the most common of them. Okay, third one is hypothyroidism, when the thyroid gland is producing the hormone but under the normal levels. Okay, so it is a condition where the hormone is in very crucial conditions. Okay, and the symptoms which is very noticeable is the person's weight is increasing, like the obesity. They will have joint pains, and later on they may have heart disease and as well as infertility. Okay, so the common symptoms for all the hypopituitarism is pain in stomach, decreased appetite, nausea, vomiting or constipation. Okay, you may feel excessive thirst, and along with that you may pass excess of urine. You may have fatigue in your body along with the weakness. You may have anemia, headache, dizziness, and sensitivity to cold. Okay, you may have weight loss in hyperactivities of thyroid or weight gain in hypoactivities of thyroidism. Hypophysitis, that is the inflammation of pituitary gland. And if we talk about women's, they may lose their armpit or pubic hairs. They may have decreased sex drives, infertility, or problem during breastfeeding, or irregular or no menstrual periods. And in men's, you may feel all the conditions are same, like loss of hair on the face, armpits or pubic area, decreased sex drive, and infertility. But if we talk about children's, they may have growth related problems and sexual development. So the causes behind is tumors, which may be benign, that is non-cancerous. If you have gone through radiation treatment, then you can be affected by this condition, like chemotherapies or brain surgeries, or if you have any head injury, or if your brain is severely affected from blood loss during childhood, tuberculosis or meningitis, and some conditions which affected you at your birth. Okay, so the diagnosis is being done by the lab test related to each hormone. There may be a different test, or there may be the biopsy of pituitary, or to check the tumors, you may go for the MRI or CT scan. So the treatment is again the same as hypopituitarism. Only three main treatments are there: surgery, medication, and radiation. So thank you. We have completed our hypo